You've definitely heard of her, but you probably have no idea about her life and achievements. I'm talking about the one and only Florence Nightingale. Born in 1820 into a wealthy British family in Italy, Florence had every opportunity to lead the life of a lady of leisure, but instead, she felt called to a life of service, and for this she chose nursing. Her family didn't support her in this, as it went against the expected role for a woman of her status. But Florence defied them. She worked hard to educate herself, fighting the restrictive social code. Florence was undeterred. She continued to follow her dream, and she was just 24 years old when she set off to help soldiers who had been injured during the Crimean War. She travelled to Scutari Hospital in Turkey and found that the conditions there were terrible. There were over 2,000 patients in the hospital with 4 miles of beds with barely 18 inches between each bed. Cholera and dysentery were rife in this hospital. She stayed there for 20 months, putting herself at risk essentially, and she was in charge of 125 nurses while she was there. Because of her kindly bedside manner, she became known as the lady with the lamp, as she would check on her patients at night using the light of a lamp. Soldiers weren't just dying from battlefield injuries, they were dying from preventable diseases. But no one really understood why until Florence came along. Florence believed that the death rates were due to stale air, poor nutrition, and a lack of sanitation, among other things. She knew she needed strong evidence to back this up. So after she returned to Britain, she began collecting evidence to show that most of the soldiers at the hospital were being killed by poor living conditions. Through crunching the numbers, Florence discovered that the majority of deaths, 16,000 out of 18,000 deaths, were due to unsanitary conditions, which meant that they were entirely preventable. Now, Florence needed to persuade people of this. She presented her findings to Queen Victoria, and the two women together persuaded the government to set up a royal commission into the health of the army. Florence's data was very compelling. She presented this diagram, which was very easy to understand and is known as the Coxcomb chart or Rose diagram. It shows a sharp decrease in fatalities following the work of the Sanitary Commission. In fact, they fell by 99% in a single year. Thanks to her statistics, countless lives were saved, and her work laid the foundation for modern public health policy. Then established the world's first professional nursing school at St Thomas Hospital in London, which set the standards for nursing schools around the world, and she helped to design the wards herself by pushing for full-height windows to let in more light and fresh air. Many people today consider Florence to be the founder of modern nursing, and her approach served as an early precursor for both the Red Cross and the National Health Service or NHS. She also became the first woman to be awarded the Order of Merit, which is the UK's highest civilian decoration. She was a statistical genius who used her brilliance to change the world one infographic at a time. There is more to say about her, but for now I'll leave you with this story of Florence Nightingale.